Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Mark Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hello, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you today?
Living it up more than ever.
All right. Well, that's a good thing. And wouldn't we like all our listeners to be living it up, right?
Absolutely. That's what we're going to help them do today.
That's right. So now, if you heard the name of the show, Living Pain-Free, then our goal is to help you live pain-free if you're suffering from musculoskeletal pain. And what does that mean? Muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, and any kind of tendonitis, perhaps stiff joints, dull aches. Basically, we're talking about orthopedics. And so what you get to do during this hour is call and speak to Dr. Darrow at 866-870-5752. That's 866-870-5752 right here in the studio. And you can also at that moment get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy. The subtitle is Regenerate, Don't Operate. It has 264 scientific studies. I counted. Also check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. It's very exciting, especially if you're visual. You get to see what the treatment looks like before you get to the office. Speaking of the office, if you've been listening for a while and you just want to call and make an appointment, people are answering the phone 24/7 or call you right back at 800-300-9300, 800-300-9300. So would you like to go to Richard, or did you want to say something? Okay.
No, let's just go to Richard, and we can weave in about stem cells and platelets into his question. So, Richard, I understand you're from Chicago, Illinois, and you have pain in the base of your thumbs. Is that arthritic, do you know?
It is. I've had it for a number of years, probably worsened in the last few years. Got x-rays this January showing osteoarthritis at the base of both thumbs.
Okay.
And so I have kind of an unusual history because in June of 2019, I did go to a prolotherapist in Arizona. And over a period of 3 weeks, she did 3 series of injections. The first one, she used Procaine and dextrose. The second one, she used PRP and something like BMP7 or something. Are you familiar with that?
Yeah,
Okay, and the third, she used Procaine and lysine and glucosamine and dextrose. So the result of that was very good. So there was a reduction of pain. I could actually snap my fingers, make a snapping noise, and that was really a big deal. But I'd say the effects wore off over a couple of years. And so I went back this January. She did the same series except without the BMP7 to no effect. And then I went to a different prolotherapist in Indiana who has been doing prolozone injections, 2 series of them, but absolutely no effect for either of that. So I'm wondering, are the thumb joints especially tricky? Are they things that most prolotherapists haven't seen, or what is your opinion?
I do thumb joints probably every single day, and I have a very, very, very busy practice. I'm told I do more of this kind of work than anybody in the country. So in my experience, it's one of the easiest areas of the body to heal. So you might consider doing some stem cells in it. That's more powerful than just PRP. The other things that were used, Prolozone and BMP7 and whatnot, to me, are just not very effective. You can do them if you like. If you get good success, bravo. I endorse you to do that. But, when you have an issue like that where you've got to be running all over the country to get treatments, and you have to come back again, then the two questions are you doing the strongest type of proliferant you can use, which is stem cells? Bone marrow is really the best way to do it. And it's very simple. It takes me, after I numb up the area on the back of your pelvis where I take it from, the procedure generally is about 15 seconds. It takes me about 3 seconds to get the needle into the pelvis, and then about 5 seconds or 10 seconds, depending on how sensitive the person is, to aspirate out the bone marrow. So not a big deal, very simple. It's like a blood draw in a way, which you've had when you had PRP. So that's my suggestion for you. The other issue is, what are you doing to irritate your thumbs? How old are you, and what sports do you do? What activities do you do?
Well, I'm about your age, except I don't look as young as you do. So I've been in the sun a lot.
Okay.
And
do you still Do you still live in Chicago, or did you move to Arizona?
I do. I do live in Chicago, and close to the Grand.
I was just there 2 weeks ago.
Oh my gosh.
Yeah. Sorry I missed you. I was visiting my family. I have a gigantic family there.
Well,
so I spent 5 days
wonderful.
there.
I mean, I may see you, depending on how this goes, but I golf a lot. And I do light weights. But things like the real pain comes from like tying shoes, flossing teeth, these movements where the thumbs are kind of...
I understand. Upward. Yeah. I've injected many parts of my body, right? I've used stem cells and platelets on myself over the last 22 years or so, and I've had really good success, and that's why I do this work. So, I'm glad to help you out. Pop in someday, and it's in and out procedure, as you know. It's pretty easy to do. The bone marrow is just as easy to do as anything else. But that really is my suggestion for you to do it.
Okay, I think that's probably why. So if I flew to Los Angeles, I could come to your office and... Yeah,
we're close to the airport, and you could fly out the same day if you wanted to.
Okay, and how many trips? Well, I know there's no way of really knowing, because I've seen your website, and some things are obstinate and some things work right away. But would you say within 2 series, or what would you think?
I really have no idea. Everybody is so different, and another thing is, how good will you take care of the area that I inject afterwards? Are you going to go play golf the next day? If you are.
No, I'll follow whatever your suggestions are, because I like for things to be done and healed as best they possibly can. So, no, I don't...
Okay. Well, the good news, the best news ever, is you had good success already, at least a little bit of the time. And those are not...
the first series.
Yeah. And like I say, I do those things, I think, almost every day, if not every day, and more than once a day. And they just seem to heal faster than most other parts of the body. So I don't think you'll have a problem with it.
That's very good. That's very good.
And the other thing is, there's a caveat. I tell every single patient, no guarantees. I don't promise anybody anything, because everybody is different. And you could have done this, you could have been treated, let's say, 3 times, and you go, it didn't work. So I'm not coming back. It could have been that 4th one that would have completely healed you. Because all we're doing as doctors is stimulating the body to generate more growth of tissue. That's why the old word for this type of treatment, it's called regenerative medicine. That's the buzzword. But it used to be called prolotherapy, and prolo is from a Greek word meaning proliferate or stimulate new tissue in this case. So, on my body, I've had many things heal overnight. I've injured myself so many times. I do sports really hard. And when I injure myself to a point where I can't use that joint again, that's when I inject. I can take a lot of pain, so I don't inject every time I hurt myself. I wait till I'm pretty much incapacitated. And It's just something that's worked on me every time. But some things have healed overnight, and some things have taken 2 treatments. And I'll be honest, I had a shoulder injury that took me months to heal. I had to do it over and over again. And I don't know why that was. And that's unfortunately part of the game of doing regenerative medicine.
Well, I think it's the prolotherapists I've gone to, they've never done thumbs before. And so I
okay. Well, that might be part of the issue. I've been doing thumbs for 22 or more years. And I think every day of the week.
Yes, so that really sells me on the idea. Also I did watch your website, and I do know your history, and we are similar age and all the rest of it. I like your take.
I didn't know that you're 16, Richard. You're only 16, huh?
Well, if you reverse that and add 10, that's about right.
We don't do math here, Richard. We don't do math here. We just say everybody's 16 or 18. That's how it works.
But
anyway, Richard, God bless you, and I'd love to see you. To call the office, just get on the phone, 800-300-9300. People will probably pick up right this minute. What else do I want you to know? Go to the website. It's www.lastemcells.com. I don't know if I have videos of me doing thumbs there, but probably, or YouTube.
Okay, well,
I've done tons of videos.
Too, I think it's going to work out. So I appreciate your time, and I appreciate what you do.
You sound like a great guy, man. I can't wait to. Actually, if you want to come in a day before, I'll take you out and play golf, and then I'll inject you the next.
Oh
day.
my God!
How fun!
Oh man, that sounds great. Well, nice talking, Doctor. And
God bless you, Richard. Have fun in Chicago, my hometown.
Oh, I love Chicago. Okay, our number right here in the studio is 866-870-5752. That's 866-870-5752. Check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. Very exciting stuff. And when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What else is going on in the office? Anything?
Yeah, we have vampire facelifts we're doing, which is injecting and proliferating tissue in the face to make people look young. And men and women do it. It's not just a thing for women. We have just as many men that come in who want to look younger and better. And hair stimulation, we do that. We put the stem cells or platelets on the top of the head. So, a lot going on. And, we may be expanding into new areas where regenerative medicine works. So we're trying to keep up on things, make people happy. And it's a really fun practice. I can't think of another type of medicine I would rather do. So I'm looking at the calling board. We'd love to get your call at 866-870-5752. I'll repeat that number in case you're driving. And if you are driving and you want to call in, it's probably better to pull off at the side of the road, get off your Bluetooth so we can hear you better. If you're at home, turn off the radio so we don't get echoes. And again, the number to talk to me right now is 866-870-5752. Nita, I'm going to go to Rich, whose sister has neck issues.
Alrighty.
So, Rich, how old is your sister?
She is 77, I believe.
Okay.
Very young, 77. She looks
wonderful.
55. She's very young.
Has she had a doctor examine her neck yet?
She has. She is currently getting physical therapy and also acupuncture.
Okay.
And she had this awful stabbing. They call it the ice pick, I guess, one side of her head. The treatments have helped that part.
Good.
But she has continual pain up, the back of her neck.
Okay.
And she does, it's the PT right now. and the acupuncture, and but she's going to discontinue that, I think.
Okay.
But it's around C4, I think, where there may be a disc issue and some bone fragments that are impacting the nerves there. And I'm wondering, Doc, if there's, if you're familiar with this sort of thing, you probably are. But
all day long, I inject necks every day, and it's very common. The most common thing I'm going to tell you, and this is it's kind of a brain twister for people to get. They come in and I explain this to them, and they don't get it. We don't look at MRIs to decide if a person needs treatment. Surgeons look at MRIs to decide to do surgery. The problem is this: you can't equate an image with a person, with a person's pain. And the reason we know that is we take people, we do these experiments. We take people that have zero pain, and we find all kinds of things. We find disc herniations in the neck and back. We find rotator cuff tears in shoulders. We find meniscal tears in knees. We find arthritis here and there, and they don't have pain. So we know that we can't equate an image with what's going on with a person. Okay, so can you believe me for that for a second?
Oh, absolutely. In fact, that's her.
Okay, good.
Her next step is she wants to do an MRI.
Well, she can do that, but what I'm telling you is that that's not the answer.
Yeah.
I'm not saying not to do it. I like people to get it. Now, this book that I'm holding up in my hand right now that people can see that are watching me has 256 studies or so showing why we don't want to equate images with a person, okay? And on the other side, a person can have terrible pain. These shooting things like your sister, the ice pick, and you do an MRI, X-ray, whatever, you don't find a darn thing. So we have to be very careful because surgeons look for things to operate on. And most of the time when I see people have surgeries who come into my office, it's a failed surgery. That means the surgery was done, but it didn't work. Why is that? Because it was usually done based on an image when the person never needed surgery to begin with. They had pain, okay? Big deal, they had pain. That doesn't mean you get surgery. So, the white horse that I ride is save people from surgery. And I've saved so many parts of my body and thousands of people who were ready to have surgery. We have people come in all the time who have a surgical date. They go, well, I can't cancel it. I have a surgical date. And I go, what's the surgeon's name? I look it up and I call and I cancel it for them. They're embarrassed to do it. I'm serious.
Yeah, that's good.
The surgeon will fill the spot. Don't worry about it.
And
then,
I wonder about that. So don't let these guys cut on you because surgeons, just like you're saying, Doc, they're all different. There are all different kinds of surgeons out there. And
well, there are. And I'm not putting down surgeons. Yeah. I'm putting down the surgeries that are being done in the musculoskeletal area that shouldn't be done. And there's studies that show this. They do fake surgeries where they'll just cut the skin but not even do anything, and then they come out the same as someone that had the real surgery. So what's the point? Well, surgery is not something that needs to be done very much anymore, except obviously in drastic cases. You break a bone, you better get surgery. You rip a muscle off, you better get surgery. And this is not a negative statement on surgeons. I love surgeons. I was in training to be a surgeon until my boss did a surgery on my shoulder and screwed it. It wasn't his fault. It's just what happens. And then a few years later, I learned about regenerative medicine. I injected my own shoulder, and it was healed the very next morning. That woke me up. That was my wake-up call.
Wow. Yeah.
I look at it like this. Go ahead.
This has been kind of, this has been, kind of traumatic for her.
I believe it.
And she.
But guess what? I used to have the same symptoms in my neck.
Is that right?
I used to have the same symptoms in my back.
Wow.
They're gone. They're gone.
Really?
I've injected. Yeah, I've done my own injections I've done stem cells and platelets on my knees, my shoulders, my elbows. I've done my right wrist. What else have I done? I'm trying to think. Other people had to do my neck and back because I can't reach back there. So when we go to our national meetings,
maybe some disc issues that are impacting the nerves there.
Well, I don't think that's what's going on, is what I'm trying to tell you, man.
again, Doc?
I don't think that's what's going on. What you think is happening,
right.
I don't think is happening. But the point is, the only way you know is if you have someone who does my work touch the area and see what's going on. You can't tell from an MRI. That doesn't tell you where pain is coming from.
Okay. So this is something that you have dealt with personally and you've seen in your practice with some regularity?
I see it every day, all day long.
Wow. I can't wait to tell my sister I've been struggling with her on this thing and just, praying for her. And it's because she's a very active, very young, vibrant, 77-year-old.
Let me just say this so you get this, Richard. You didn't mention pain down her arms. You said neck pain, correct?
I did, but she does have an arm issue, too.
Okay. I'm not sure about the arm issue because I was dealing with the neck issue. If she has an arm issue and that's the real problem, that's a different story, okay?
Mm-hmm.
And some of that can be helped sometimes by chiropractors, okay? Sometimes there can be an impingement on a nerve, and sometimes a chiropractor can do some decompression and get that thing, whatever it is, it could be bone, it could be disc, whatever, off of that nerve by just stretching it. And we have a lot of people that we've had that happen too. But a lot of times I'll just inject the neck and the arm or leg pain coming from the back goes away. So we have to be very careful not to jump into surgery when we have something like that. I've had people with numb legs heal up. I've had people with burning down their arms heal up without surgery. And I've had many people
thinks that the arm issue may actually be a shoulder issue.
Okay, there you go. Oh, there you go. But I've also had many people that have had these symptoms that get a surgery that get a lot worse. So surgery is not something that I send people to. I don't remember the last time I sent someone for surgery for that.
Yeah.
The other thing is she needs to get, you should write this down, she needs to get what's called an EMG and a nerve conduction study to see where that arm thing is coming from, because it may not be coming from her neck at all. Those are nerve tests you do, and they can see where the impingement is, if in fact it is an impingement. Now, someone who has shoulder problems can have pain referred down their arm. Someone with neck pain can have pain that's referred down the arm. That's not nerve.
Mm-hmm.
Okay?
Oh.
There are just referral patterns.
Yeah. Well, we're definitely not headed towards the surgeon's table. That's not been an option thus far, but she did want to get an MRI, to see. But you're saying that...
Well, I'd like her to get an MRI if she were my patient, but I have to instruct her beforehand, don't believe the MRI as the cause of your pain. A good examination has to be done. And I cannot tell you the thousands of people who have come to me with a failed surgery where the surgeon never touched their body. They slapped an MRI or an X-ray up on the wall on the light board and said, you need surgery. I go, you mean the surgeon never touched you? And they go, no, why would they touch me? They showed me what was wrong.
Mm-hmm.
So, and a good examination is the very first thing to get on the road to healing, to find out where the pain is being generated from. Okay? We got some other people waiting here, man. So God bless you, Rich, and your sister.
Thank you for your call, Rich. Appreciate it. Our number is
866. So Mike, Dr. Mark Darrow. Yeah, the number here is 866-870-5752. Give us a call. I want to talk to you. I'm going to repeat it. 866-870-5752. Mike, how are you today?
Mike. Hello?
Mike, yeah.
Hello?
Dr. Mark Darrow. I understand your low back hurts?
Yes, this is Mike and Kelly. I'm outside, and he's listening to Insight. Not here, honey, because you're on Inside. Mike has, I guess, 3 and 4, 4 and 5, that's bone on bone, and then he's got the S1. Yep. Yes, we had an MRI in January.
Yep.
He's got pain running down his left leg.
Okay.
Kelly, stay with us. Don't move. We're going to come right back after our break, right here on Living Pain Free with Dr. Mark Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Mark Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.